Yeah, it did like 110,000 or 110 million.
110,000 would be great.
110,000. They did so well.
We watched it 3 times for that.
Right.
$4.
Yeah.
We got it for
20
$20.
bucks.
You got it free.
18.
Did you say the dollar? I did. Hired?
It is help. That's great.
Oh, thank you. Well, that's that pink phone back there. That helps too, especially when you know awful these falling apart. Yeah, and how are you today? Thank you. I even have on, I can't even remember.
Is that red light solid or something?
Solid. Is that good?
Yeah, it's supposed to mean that it did it. Did it twice.
Yeah, you could just teach me what to do like, at this point. How's everybody today? All right. Good? Okay. All right, good afternoon, everybody. Today is Wednesday, April the 29th. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I'm here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, Dr. Brenda Weiss, Administrator for our Office of Public Health, and Dr. Al Wong, our Regional EMS Director. Since yesterday's press briefing, we have 173 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 4,037. Of these 173 new cases, I just want to point out that 49 of them are individuals that are inmates at the Montgomery County Correctional Facility, and 3 of them are staff at that facility. These positive individuals are from 36 municipalities, none of which are reporting new cases today, so this keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. And for those of you wondering, where is the 62nd? It is Bryn Athyn. They have somehow remained unaffected by this. These individuals range in age from 1-year-old to 95 years old. And I am going to dispense with the reading of the age brackets from here on out. We do update all of this information at montcopa.org/COVID-19, and you can check it there. I will share with you that we had 76 females and 97 males. 3 were known to be hospitalized. 5 were not hospitalized. Of course, the individuals at the correctional facility or at the correctional facility, and the remainder we do not have information on. I am saddened to confirm that 11 more Montgomery County residents have lost their lives to COVID-19, which brings us to 244 deaths confirmed positive from COVID-19. 1 of those individuals died at a hospital, 9 died at a residence, and 1 we don't have information on. These individuals ranged in age from 63 years old to 92 years old. And in sum, we have 122 females and 122 males overall that have lost their lives to COVID-19. I mentioned that gender statistic because in other countries there's been a disproportionately large number of males that have lost their lives to this disease over females, but we are not seeing that here in Montgomery County. Today's racial breakdown, we have 12 Asian, 2 Asian Indian, 3 Asian Korean, 28 African American or Black, 85 white, and 114 unstated or unknown. Now, in terms of probable deaths, and these are deaths defined as COVID-19 being listed on the death certificate as a cause of death, but not confirmed by a lab test, we have 78 total probable deaths today. If we add that to our confirmed positive number of 244, that gives us a total of 300, and actually this doesn't, 300, I'm doing math here in real time, 392. And I just want to remind everybody that that probable number goes up and down every day, because some of these deaths that are initially felt to be probable, we do end up getting lab confirmation of those deaths. So that number will go up and down each day. Our hospital numbers continue to be stable, with approximately 400 COVID-19 patients hospitalized right now. Just to put that in perspective, on March the 23rd, we had only 15. So it just gives you some sense of how rapidly escalating this disease has been in our county. In terms of our long-term care facility update, we continue to have 90 facilities that are reporting positive cases of COVID-19 among their staff and their residents. Today, we have a total of 1,050 cases, 1,050 cases among residents, and 439 among staff, which is a total of 1,489. I want to remind you that not all of these individuals are Montgomery County residents, so these numbers do not tie to those official numbers that I gave you just a few minutes ago, but we do continue to track this as its own number to help the public understand what an important and serious challenge our long-term care facilities are facing. In terms of deaths from long-term care facilities, 199 of the 244 confirmed positive deaths of Montgomery County residents, which is about 81% of the total confirmed positive deaths, are from individuals in long-term care facilities. We continue to do outreach to many of our hardest hit facilities. By the end of the day today, our Field Assessment and Support Team, or FAST team, will have visited 27 institutions since late last week. These visits are designed to help the facilities in any way that we can. We review infection control policies, we check in with their PPE needs, answer any questions that they might have, make sure that they're using PPE correctly and following CDC and Pennsylvania Department of Health guidelines as much as we can, assess that they're following those guidelines correctly. And we are recommending that they perform viral testing on everyone, on all of their residents and all of their staff. We think this is the quickest way to get a handle on these infections, so they can make sure that they are isolating and quarantining the proper individuals and staff. I also want to announce today that hopefully by early to mid next week, we will be able to post on our data hub, which is montcopa.org/COVID-19, not only the total number of new cases each day, but how many of these new cases are from a long-term care facility. There's been a lot of requests for this, and we're working on the technical piece of this, and we're trying to do it as accurately as we can. It probably won't be precisely 100% accurate, but we're going to do the best that we can. I want to remind people, though, because there's a sense out there that somehow these long-term care facility cases don't matter. I just want to remind everyone who's listening that these individuals do go to hospitals. Yes, it's correct. There are some individuals in long-term care facilities who have do not hospitalize orders, but there are quite a few who do not. Some people are in these facilities because they're rehabbing from a hip replacement or something like that. So I want to remind everybody that these numbers matter. When these individuals go to the hospital, it's frequently a 911 call that is placed, and so that exposes our first responders. When they get to the hospital, obviously they will occupy a bed and expose healthcare workers. So I just want to remind everyone that these are our fellow human beings and community members, and these numbers matter. And I also want to remind you that the staff who are working so incredibly hard at these facilities to keep their residents safe and well cared for are also being exposed, and the staff go home to their families in our communities. And so these are all people that matter. In terms of the Montgomery County Correctional Facility, things are stable there. As I mentioned yesterday, we received all of the test results back from the inmates, and of the 942 inmates that were tested, we had 171 that tested positive. We were previously aware of 6 individuals who had tested positive, so that's a total of 177 individuals that have tested positive. Of those original 6, 2 had recovered and were out of isolation, and the remainder of all those individuals remain in isolation, and as well as a large number that remain in quarantine due to a possible exposure. From the last report that I had this morning, none of the individuals who have tested positive are showing any symptoms. And again, all 171 of those people did not have any symptoms when we tested them. And just another example of the importance of why we need to be testing, particularly people who live in congregate facilities together. There could be large numbers of asymptomatic patients, but who are carrying the virus and could be contagious. Okay, moving on to our testing sites. We want to thank both the folks at our Norristown walk-up site, the Delaware Valley Community Health Clinic, led by Dr. Scott McNeil and Dr. Julia DeJoseph, as well as the site at the Montgomery County Community College, located in Whitpain, who we want to thank, as well as their police department and the National Guard and the many county departments that are supporting both of these sites. I need to announce that both of these sites will be closed tomorrow because of the weather forecast. There's both high wind and torrential rains being forecasted for tomorrow, so we are not going to take any chances, and neither site will be open. We are hoping that both sites will be able to open on Friday, but this is not certain. So we will have a better sense of that tomorrow. It will depend upon the timing of this storm. There is flooding anticipated overnight tomorrow night, so we may have to call an audible Friday morning. But if they do open, appointments for Norristown will open Friday morning at 8:30 by calling 610-592-0680. And appointments for the drive-through testing site will open Friday morning at 8, and those appointments can be made online at montcopa.org/COVID-19 under the green County Testing Information button, or you can call starting Friday morning at 8, 610-631-3000. So yesterday, hopefully, many of you got to see the Blue Angels fly over our region. If you didn't live somewhere in the county where you were able to see it in person, hopefully you saw some of the amazing pictures that were up on social media or were carried by many of our news channels. I just want everybody to know that 2 of the pilots are from Montgomery County. One was Lieutenant Commander Adam Carrick, who's a native of Huntington Valley and graduated from Abington High School in 2001. And the second was Commander Todd Royals, who's a native of Willow Grove, Pennsylvania, and graduated from Upper Moreland High School in 1997. So we just want to thank both of them, as well as the entire Blue Angel team, for bringing a little joy and happiness to our lives yesterday. It was a perfect day for it. The sky could not have been bluer, and it was really quite inspiring. I didn't get to see it in person either, but I watched a lot of the newscasts and other photos. It was pretty great. So I just kind of want to check in with everybody on a little bit more of a personal level here. Thanks to your many, many sacrifices, and there have been so many, we have flattened the curve here in Montgomery County. And now we're going to need to learn how to live with this virus until there is a proven treatment or a vaccine. So what are the goals of living with this virus? Well, I have a couple I want to share with you. We need to safely restore economic activity and safely get as many people back to work as possible. We need to safely reopen childcare so parents can get back to work. We need to safely reopen our schools this fall. And at the same time, we need to continue to protect our hospitals, our hospital workers, and our first responders. This includes our hospitals being able to safely resume elective surgery, which we know many of you are out there patiently waiting for. That our hospital workers have enough PPE so they can use it as they would normally. That our hospitals have more COVID-19 patients being discharged than being admitted. And that their total number of patients can be accommodated in normal patient care areas. This includes being sure that when you call 911 for any health emergency, a first responder will be available to pick you up, and there will be a hospital bed waiting for you on the other end of that ride. What will this take? Looking at our current data, including hospital utilization, we believe we continue to be at a plateau. So that's good, but we must work to get our numbers lower. And looking at our chart that we've shown a couple times this week, that's that green line. We should think of where we are now as our ceiling. So this black line on that graph, where we're running about a 15% positivity rate at our testing site, we need to think of this as our ceiling. This is about as high as we ever want to be again. And definitely we don't want to be on that red line going even higher. Now we have some time before we will reach the governor's target for moving to the yellow phase. Let's use this time wisely. Each of us needs to think about what steps we can take in our personal lives and in our work lives to learn to live with social distancing. Social distancing needs to become second nature and socially expected in the same way that shaking hands used to be. And I'm going to put shaking hands in the past tense because we are not going to be shaking hands for a very, very long time. If you are someone who runs a business, think about what steps you can take to operate your business responsibly. How can you create a business environment that makes your employees feel safe and encourages your customers to want to patronize your business because they have confidence that they will be as safe as possible? If you are someone for whom COVID-19 is more likely to cause serious complications, think about what you need to feel safe during this time. How can our communities come together to support you? We need more testing, particularly the rapid virus testing. The county is actively working to significantly expand our contact tracing team and look forward to beginning contact tracing as soon as our numbers get down a little bit lower. The county is actively evaluating options to provide additional financial support to our small business community and our safety net organizations, both of which have been deeply impacted by this pandemic. We will get through this if we each do everything that we can to be part of the solution. If we all follow data-driven recommendations and evidence-based solutions, we will beat this thing. For now, you must stay at home. But use this time wisely to make your plan. And together, as long as we hang together, we will be Monco strong. And with that, I'll turn over to Commissioner Joe Gale.
Hello everyone, I'm Montgomery County Commissioner Joe Gale. In previous press conferences, I discussed how utility providers such as PECO have made accommodations for customers suffering financially during this crisis by suspending service disconnections, waiving new late fees, and reconnecting customers who had previously been disconnected. In today's world, internet access is an essential service for many Americans. In times of crisis such as this, many people rely on the internet to obtain information about the pandemic and the response efforts to combat it. In fact, tens of thousands of people watch these daily press conferences online through Facebook or other live streams. In recognition of the necessity of their services to their customers, in mid-March, virtually every major U.S. broadband and telecom company committed to waiving late fees and not canceling services for 60 days. Now, several providers are extending this policy. AT&T, Comcast, Verizon, and T-Mobile have all extended their policies to not charge late fees or cancel service for customers and small businesses affected by COVID-19 through June 30th, 2020. If you are unable to pay your bill due to the pandemic, you will likely have to tell the company that you are experiencing hardships and need more time to pay. You should contact your service providers through their website or by phone to see what options are available and how they can help you. In addition, Verizon recently announced that they would continue to offer an additional 15 gigabytes of data to help wireless customers through May 31st, 2020. During these times of crisis, we cannot succeed without the help and ingenuity of the private sector. Thank you to all the businesses who are doing what they can to keep our citizens safe and informed during this difficult time. And with that, I'll turn it back to Commissioner Arkush.
Okay, happy to take questions.
Just to clarify, with the number, so 171 tested positive, there were previously 6 inmates at the county correctional facility. Is it 165 who are showing symptoms or 171 who are showing symptoms?
171.
Okay, so that is 177 total.
The original 6 showed symptoms, which is why they were tested. So, and that was part of what prompted us to test everybody. And so now we have the 171, no symptoms, and as far as of this morning, continue to show no symptoms, but did test positive. And the question was how many of those correctional facility individuals were showing symptoms versus not showing symptoms.
On Friday, we'll start to see some things open up, some restrictions loosen here in Montgomery County, golf courses.
Well, that's the governor's order. The governor, I think, is allowing golf. I don't think we have any marine terminals here in the county. And there was a third category, wasn't there? Oh yeah, private campgrounds. So those under the governor's order are able to open, yes.
A reminder for people who, after 2 days of stormy weather, are probably going to be seeking those out from this weekend.
Well, I think the golf courses are going to be pretty darn wet this weekend, so golf may not be in anybody's future this weekend. We'll have to see. But again, back to my earlier comments, think about how you can do those activities responsibly, how you can maintain social distance. That has to be how you approach every single relaxation of the restrictions that we have all been under. If you don't do that, we're going to be on this red line, on this graph behind my back 2 to 3 weeks from now. And instead of talking about being ready to open up a little bit and move to that yellow phase in the governor's plan, we're going to be talking about another month in the red phase. So again, it's in your hands, folks. You need to take personal responsibility for your actions. I can't make you do it. There's not enough law enforcement to make you do it. This is on all of us. We're all in this together. Your actions impact me. Your actions impact your parents, your kids, everybody else. This is a time for everybody to step up and do the right thing. I know you will. I know you can. You just have to decide to do it.
Some businesses require close contact, barbershops, hair salons, nail salons, those kinds of things. Are you hearing from business owners about what kinds of things need to be implemented? How do they even begin to figure that out on their own?
So the question is, some businesses, like a hair salon and a barbershop, which every one of us is hoping can open as soon as possible, need to have very close contact, obviously, with their clients. And there's, of course, many, many other examples of that. So this is my earlier point of we've got a little time here yet in Montgomery County. You know, start thinking about it. What do you need to make that work in your business? I think the answers are going to be different for a lot of people. I can share with you, I've been told that at some of our county meat processing facilities, and we have several quite large ones, they've taken steps to slow their processing lines down, to put up either plexiglass or thick plastic sheets between workers on the line, put in many, many more hand washing stations, and all sorts of other steps. So again, for each business, it's going to be a little bit different, but this is a good time to start thinking about, like, really practically, what is it going to take to try to meet some of these social distancing goals. And certainly for a place like a salon, for instance, or a barbershop, real masks, at the minimum surgical masks or even N95 masks that truly prevent the transmission of the virus. That could be an example that a place like that might need. This is the time to think about and identify those needs so that orders can be placed. We can certainly start to highlight best practices. If people have examples of that, we can work with our Commerce Department to help promote some of that information. So we're happy to be part of that solution.
Will there be a statewide requirement for some of those places, and will there be inspections, or is that, are we not even at that level yet?
So the question is, will there be statewide requirements for those places of business? That is a question for the governor. Based on the other things that he's, just even the little bit of notice that came out for the businesses this weekend, I think there was some detail around that. I know there were rules about golf carts and things like that. So I would hope that as the governor decides that it's okay for certain businesses to open, that will come with guidance, but I don't know.
Can you, I don't know how much you can say about it, the new technology that we tried out today to get our temperatures taken, just kind of what is that? Is it, how?
So the question is, when the press came in today, we had some new technology that we were working on to validate, and it is I guess, is it an infrared thermometer? Yeah, it's an infrared thermometer, and you stand in front of a measuring device, and behind you, you actually stand between two devices. So behind you is a reference device, and then you get between the reference device and the infrared device, and it bounces, I think, 2 signals off and compares the temperatures, and it measures your temperature. So it's a way of getting a temperature without touching you, because, Why, you just let that go right by me.
Well, I guess, is there hope that could be something that a lot of businesses could have? I mean,
Sure.
the shop kind of have that up front.
Yeah. Yeah, so the question is there a hope that would be the type of thing that other businesses could have? And absolutely, I think, we've seen in the countries that are way ahead of this, and by way ahead of this, I mean, 2 months ahead of us in this, incredible uses of technology. Temperature monitoring is one. We've seen, certainly in the early days from China, we saw all sorts of photographs of businesses that had these thermometers set up that just automatically scanned everybody that walked in the door. I think those kind of technology solutions would be extremely helpful in situations like this.
And is that price-wise something that's feasible for a lot of businesses, or is it like?
I have no idea what the question is what's the cost of a device like that? I have no idea. Do you know, Al? It's
That device is about $3,000.
yeah, so that's a no. So that particular device that Mr. Melwert experienced today is about $3,000. So obviously for a small business, that's completely out of the question. But there may be other devices, simpler devices that would be okay for a small business. But a device like that for a larger business with hundreds of employees might make a lot of sense.
But again, you still have people coming in that are asymptomatic.
So the question is, what about the people that are asymptomatic? And this goes to my point about we need more testing. We need more rapid viral testing. I don't know how many ways I can say that. And it's not that the technology doesn't exist. It's that there's not enough cartridges and machines literally on the market to buy. We need to be manufacturing so many more of the machines and cartridges to do rapid testing.
What does that look like every morning you get up, give yourself a test?
So the question is, what would that look like? How it would look would depend upon how many tests we had available, but I could imagine a scenario where particularly in places of higher vulnerability, where either the workforce was vulnerable for some reason, or people were at risk for certain types of exposures. Maybe it's a workplace where it really is quite difficult to socially distance people. they could implement some kind of a routine, regular testing strategy. So not every day, but maybe every couple days or once a week, that type of a thing. And that, again, that would be in places where you just couldn't possibly social distance because of the nature of the work. But it might be a way to allow a place to open up more safely. Are we going to have all that rapid testing? No. So I think that this is where we're going to have some risk benefit here. We're going to have to learn how to live with this virus until we have a treatment and until we have a vaccine. And in the course of learning to live with it, we each have to figure out what can we do to make it as safe as possible. And for some businesses, I understand that's going to be very challenging. And so we need to do what we can to support those businesses and help them be innovative and think of safe ways to do this. But in order to open up some businesses, we are going to have to accept some level of risk in the absence of widespread rapid testing. So I continue to hold out hope that there'll be a call to make more of these tests. I have not yet heard that call. Anything, Todd, from, no? Nothing from outside?
Is there any movement, and I know Joe talked about PPE numbers, is that starting to flow more freely, or are you getting back to?
So the question is, how are we doing overall on PPE? There are still no gowns. There's a national shortage of gowns. Nobody can get gowns, impervious gowns. I understand that a lot of places are starting to buy washable gowns so that they could wash them every night and then put them back into use every day. In terms of masks, it's better than it was, but I know several of my friends who work at major health systems have told me in the last week that their health systems have all bought systems to disinfect N95 masks so that they can more safely be reused. So nobody is using PPE in the way that we used to use it at the hospital, where you use it and get rid of it. We are a long way from that. And people need to remember that. When I talk about what can you do at your business to try to make it as safe as possible, well, we have to look no further than our hospitals that have come up with incredibly innovative solutions to protect their staff and to protect the patients that are there. And all kinds of innovative things have been created in the last 8 weeks. And we're just going to have to keep doing that. We are a smart people. We have really interesting, innovative ideas. And we need to test those ideas. And the ones that work and are successful, we need to scale them up as quickly as we can. Because it's going to be a while. We are going to be living with this virus for a while. All right. Thank you, everybody. We will see you tomorrow.